board chair of Amoskeag Health. Please continue to enjoy your breakfast as we go along. On behalf of our board, staff, and volunteers, I wish to thank you for joining us as we celebrate the progress and promise of Amoskeag Health and recognize and honor the legacy and the tenacity of the late Dr. Selma Deitch. Manchester is near and dear to me as a person. I grew up here. I've raised my family here. I've worked in the community for a long time. Manchester is home. And whether you're a native to Manchester or you're new to Manchester, you learn pretty quickly that the care that we give people, especially in healthcare, is really top-notch and something in everybody's world. We take care of our people here. As someone who works in the insurance business, I certainly have an understanding about healthcare, how it's provided, and what it costs. But it wasn't until I became a part of this board where I learned how some of this works and how the FQHC, Federally Qualified Health Centers, work in this network. It's truly amazing, and I appreciate all the work that is done in public health, all the other things, and how we fit in this network is really important. It means a lot to every patient, and quite frankly, to everyone in the city. Not people who are patients of Amoskeag Health, but everyone overall. This morning, we'll be sharing some exciting updates on our works, some of the insights of the vital position Amoskeag Health plays in our greater community, and of course, memories of Dr. Deitch. You'll also hear from a parent of one of our patients and the pivotal role Amoskeag played in her son's healthcare. On behalf of the board, I want to take this opportunity, I can't do this well enough, to thank the staff of Amoskeag Health for coming to work each day with a singular mission, putting the health and the well-being of our patients in the center of all that you do. Thank all of you. Appreciate it. I'd like to also thank and recognize our volunteer board of directors. These are tireless community leaders who guide our mission by dedicating their time and talent to Amoskeag Health. Some of you have joined us this morning, and I'd like to invite them to stand, and a round of applause for them. That's how well they usually listen to me. Next page. Support from businesses and organizations across the community is integral to our cause, and I'm pleased to salute and thank those who stepped in to support us in today's event. Special thanks to our program sponsors, AmeriHealth, Caritas, Catholic Medical Center, CGI, Efficiency Energy Investments, the Harbor Group, Orchard Medical Management, and John Siegel and Sally Reed. Now I'd like to thank some of our advocate sponsors, Elliott Health Systems, Needham Bank, New Hampshire Health Families, Sarah and Rich Siegel, and WellSense Health Plan. And finally, I'd like to thank our table sponsors, Associated Grocers of New England, Barry Dunn, Granite State Credit Union, Harvey Construction, Linder Dental, Manchester Community College, Massachusetts College of Pharmacy and Health Sciences, Primary Bank, Northeast Delta Dental, Shaheen Finney, and Solvair Health. Thank you one and all. It shows you how broad our touch is. We really appreciate each and one of you. Great job. And now it's my distinct pleasure to introduce the mayor of the city of Manchester, Jay Ruaz. Welcome, Mayor.
Good morning, everybody. How are we doing? I have to apologize if I come off a little bit lethargic. We had, for those who may have opened the paper this morning, we had a board meeting last night. I got home around 1 o'clock, 01. But it was a good opportunity. We had a robust conversation about the budget. But looking around this room, this to me is like the epitome of Manchester. So many different sectors are represented and showing up this morning for an absolutely unbelievable cause, and I'm so honored to be here. Thank you, Tom, for the kind introduction. Thank you all for being here this morning. Thank you to the sponsors for your efforts. Anna may say this later on today, but a vision without funding is an hallucination. So thank you all so much for your continued contributions and truly making a difference in the lives of the kids in the city. So in my life, I have a number of titles. I wear a number of different hats. Mayor, obviously. I'm an officer in the National Guard, so lieutenant. If you listened to the public comment period last night, there are a couple other qualitative adjectives I'm sure you could add to that list. But the most important title that I have is Dad. And being at home with our daughter for the last 16 months, or having her, grace our lives with her presence, just in the last month, we've been to urgent care. She's fine, but we've been to urgent care. We got the amoxicillin that we needed. She had her annual checkup with the NICU. We have the Moore Center that comes in every 2 weeks and checks in on her as well because she was born premature. All of that is what? It's medical care, right? And it is building that foundation for all of her future successes. And it's incredible to see. And as mayor, one of the beautiful things about being mayor is being so close to the ground. LBJ used to make this joke. President Johnson used to say that whenever the pressures of the office of the presidency get to me, I think at the very least I'm not a mayor. But I think what he meant by that is that everything that we feel here as mayor or as an alderman or school board member or governor, we are so closely tied to the people that we serve that we see all of the challenges up close and personal. And being mayor, I can truly attest to that. When I'm talking to families who might be struggling with childcare, when I'm talking to them about basic services like healthcare, when we talk about the incredible work that Amoskeag Health does every day, we see that up close and personal. And we're so blessed to have an organization like Amoskeag in the city of Manchester that is providing that desperately needed care to families that are in need. We're so fortunate to have them partner with our school district and working with the families that are in need there. We're so fortunate to have them working with our health department on a daily basis, making sure that the kids and the families that are in need of that care are able to get them. And a lot of that, as we all know, is uncompensated care, which is why this breakfast is so important this morning, the 19th annual breakfast, I understand. And I've been to 3 of them now, so 1 in every 6 I've been, yeah. But so we're so fortunate to have Amoskeag Health in the city of Manchester and making a difference every single day in the lives of those families and building those foundational blocks for both those families and, most importantly, for those kids. I used to work for a nonprofit that helped people with addiction-related issues, and we know that these problems compound when they start in youth. And the opportunity to have an organization like Amoskeag making that difference in the lives of our kids and families every day is truly impacting generations to come. So thank you so much, Chris, for the work that you do. Thank you to the board. Thank you to all the volunteers. Thank you to all of you for continuing your support. And with that, I would love to welcome Chris McCracken up to the stage. And thank you for the work that you do every day in the city of Manchester. Deeply appreciate it.
The wonderful thing about having colleagues in your age range is many of us wear readers, and I got a loaner from a neighbor. And I'm really grateful right now. So thank you, Mayor Rouet, of course, and to you and your team. Very excited to have Anna here and others who have supported the work that we've done for so many years. I'd like to also thank the board of directors, following up on Tom's comments. Your hard work, your leadership, and your dedication to our mission are inspiring, and I greatly appreciate everything you do to support our work. And let me just tell you, our board works hard. Thank you. And speaking of volunteers, let me please thank the amazing group of people who work tirelessly every year to put this event together. We have a regular event committee who includes Laura Boutot-Gilman, Janet Clark, Norm Fortin, and our committee chair, Judith Jolton, and a host of our staff that are here every year tirelessly making sure that this event is successful. Judith, we're very grateful to you and your continued commitment to children in need, but we're thankful to the committee and all of the staff that make this event possible. Please join me in thanking them. As we celebrate our 19th Morning Matters event and honor more than 4 decades of public health service by our organization to Greater Manchester, what was true then remains true today. We are here for you no matter what. From newborns, children's, teens, adults, families, and older adults, we are still your provider. If you have a life change or a work change that impacts your ability to have coverage by benefits, we're still your provider. You have private insurance, government insurance, or no insurance, we're still your provider. If you lack stable housing, you have a disability, or perhaps you're a veteran, we're still your provider. And if a life change happens and you leave us, but later need you find that you have to come back, we're still going to be your provider. Later in the program, we'll share an appreciation of the late Dr. Selma Deitch, who founded Child Health Services. For those who knew Selma, and I did, you knew that she was always there for her patients, and so are we, no matter what. We proudly care for more than 17,000 patients, and about a third of those are children that are under the age of 18. Nearly 2/3 of our patients live at or below the federal poverty guidelines. This event directly supports the uncompensated care that we provide for these individuals that have a great need, and that need has never been greater. While the cost of delivering high-quality care continues to rise, I think rates for pay have risen 25 to 35% in the medical field since the beginning of the pandemic, and we're all feeling that intense pressure on our organizations. The funding streams that we depend upon haven't kept pace. Federal health center funding has remained largely flat for more than a decade, but all those other costs continue to rise. At the state funding level, our support today is actually lower than it was in 2009. At the same time, we're facing new challenges that may increase the number of uninsured patients that are going to be seeking care. Beginning next year, Medicaid work requirements and other eligibility criteria that are changing may result in individuals losing coverage, not because they're ineligible, but because of the many administrative barriers or changes in those requirements. Combined with reductions in several of our federal funding programs that support the public health services, these changes are going to put additional pressures on the safety net. And many of you are from nonprofits in our community, and you understand that that pressure is going to be on you as well. So when a parent comes in with a sick child, or that expectant mother needs prenatal services, or somebody struggling with mental health or a substance use disorder condition, we're not going to ask whether or not there's funding. We're not going to ask whether or not that patient has health care coverage. We're going to provide the care that's needed because it's needed. That's what community health centers do, and that's why your support today is so important. As you might expect, majority of our pediatric patients live in Manchester, but we also serve children from Auburn, Bedford, Candia, Deering, Hooksett, Litchfield, New Boston, and Weir, and other cities that you would not suspect will travel into town. Beyond quality primary care, our patients might need transportation, they might need interpretive services. 43% of our patients require an interpreter to access medical services, and over 50 languages are spoken at our health center, and I would say at least 12 of those are spoken by our staff. They may need help with eye care, prenatal care, prescriptions, care coordination, or special medical programs that intervene and help them thrive. We also provide many programs for substance use disorders and mental health conditions. Many of those services help patients successfully engage and remain engaged in care. All of those services and the many supports that we offer are partially reimbursed or not reimbursed at all. But these are often the difference between somebody staying safely in the care loop and somebody potentially falling through the cracks. Your philanthropic support helps ensure that those services remain available to everybody who needs them. It's been 12 years, can you believe that, since we joined forces with Child Health Services, and we continue to provide the pediatric and other services at the Dr. Selma Deitch Center for Children and Teens that we've provided before that. Thanks to the generous and kind support of the individuals here today and others before you, we've been able to make critical updates and improvements to the center, making it more convenient and more accessible for patients, their families, and more efficient for our staff. Since 2014, we've been able to leverage more than $1.5 million in federal funds, and we've matched that with $500,000 in support from our donors and our local foundations. Those investments are a powerful example of what can happen when public and private support works together. Community philanthropy helped us leverage federal resources and transform those dollars into lasting improvements to benefit our patients every day. Those resources have been invested into the center, and now the building has a full sprinkler system, an elevator, and a redesigned patient care area that improve access. Many of you might have heard about the tank we found in the ground, in the hole we dug to put the elevator in. Just saying, didn't know it used to be a gas station on Elm Street. Surprise! We also offer care across several other sites in Manchester, including a site at Doctors Park, right near Elliott Hospital, a site within the Mental Health Center of Greater Manchester, our good long-term partners, our Hollis Street location, and a new West Side home opening soon in September at the Mark Stebbins Community Center. Yay! And that's a really exciting, engaging project, and we're really blessed to have the partnership of Manchester Housing and Redevelopment Authority and that Kelly Falls Housing Development. And will be an anchor tenant along with our good partners at the Manchester Boys and Girls Club. Hi, Diane. We are also fortunate to have longstanding and generous support from both Elliott Hospital and Dartmouth Hitchcock, who provide access to testing, specialty care, and tertiary care for our patients, as does Catholic Medical Center. But that's not all. We also offer services through the Manchester School District and community-based collaborations with numerous nonprofits, many of whom are here today. We offer telehealth, our special medical program staff travel across the state to support children with special medical needs. In short, we try and meet our patients where they are. Our caring and dedicated staff includes over 206 people as of the report I ran yesterday. And all of them come to work every day with a singular purpose of ensuring that our patients receive the right care at the right time. On that note, I can't thank our employees enough, not only for their skill and their patient-centered care approach, but for their remarkable ability to evolve our work, meeting the ever-changing challenges in the landscape of public health. Please join me in thanking this team of talented individuals for their service to this community. Like many of the community health providers across the country, Amoskeag Health finds itself at a pivotal moment. The demand for care continues to grow. Patients are facing ever-increasing challenges relating to food scarcity, housing insecurity, mental health needs, transportation barriers, and access to affordable health care coverage. At the same time, many of the public resources that support safety net providers are either stagnant, declining, or increasingly uncertain. The opportunity before us is to ensure that these challenges do not define the future of health care in our community. Together, we can build a system where children receive preventative care before they become sick and families receive support before a crisis occurs. That vision is possible, but it requires an investment from all of us. On the displays around the room, I saw some of you wandering and looking. Please take a look at the information that's presented there that our staff put together. And I encourage you to speak to a board member. If you've got one sitting at your table or at any time, please reach out to us with any questions you would have. I would also encourage you to follow up with our social media. I know Bethan's here, Bethan, and stay in touch with us via our newsletter. In closing, I'd like to thank you for spending a part of your day with us today. Your support is critical in helping us create a healthier present and future for our children, our families, and the individuals that we serve. Today, that commitment is more important than ever. As healthcare continues to change, one thing must remain constant: access to care. Your partnership will help ensure that when a patient turns to us for help, the answer will continue to be yes, no matter what. Now I'd like to turn you over to Betsy Burtis and our talented panel of speakers. Thank you so much.
Thanks, Chris. Good morning, everybody. You'd think I would get tired of hearing Chris speak, and every day I do hear from her. It's usually a quick Teams message or an email, but I always love hearing her speak at these kinds of events because it reminds me of why I'm inspired to work at Amoskeag Health every day. So thank you, Chris, for your leadership and for all of you for being here. So, as you heard from Chris, we are proud to be at the center of care for thousands of area residents. In the next part of our program, we wanted to shed some light on the important role that FQHCs play in the healthcare ecosystem of the larger community and have you learn from area experts on how this system of care benefits more than just patients. So I'm pleased to welcome three guests who will come up one at a time and not have to share the microphone. Stephanie Paluca, Senior Director of Workforce Recruitment at Bi-State Primary Care. Anna Thomas, Public Health Director at City of Manchester. And Anna, it's so nice to see you in person. I just used to your picture on a screen. And Dr. Stephen Perez, who is a retired physician and one of our board members at Amoskeag Health. So let's start with Stephanie. Come on up. Please share with our audience the big picture view of the FQHC world.
Okay, great. Thank you. If my glasses look familiar, maybe you know why. Okay, just saying. Thank you, everybody, for allowing me to be here today and to talk to you about you already know a lot of the wonderful work that Amoskeag does, but talk to you a little bit about what the role of a federally qualified health center is and how Amoskeag fulfills that role, and more, as we heard from Chris. I'm the Senior Director of Workforce Development and Recruitment with Bi-State Primary Care Association. Bi-State is an organization that actually helps federally qualified health centers and safety net health providers with their clinical, financial, performance measures and operations to help them do the wonderful work they do in the community. And we do that in both Vermont and New Hampshire, thus the Bi-State. Let's see, okay. So, federally qualified health centers is a federal designation, as it says in its name. And it really is meeting a lot of specific requirements that Amoskeag Health goes above and beyond. But there's a saying that is, if you've seen one health center, you've seen one health center. And as we learned, and many of you know, the wraparound services and all of the ways that Amoskeag Health fills in gaps in this community are similar across the country because Amoskeag is one of about 1,500 federally qualified health centers across the country. They receive federal funding to do some of this work that comes along with more than 90 programmatic requirements, just the 90. So they have a lot of work to do to get that funding that they receive. But it really is about some basic tenets that federally qualified health centers fulfill. They see patients regardless of their ability to pay. We heard Chris talk about the amazing services offered at Amoskeag and seeing patients regardless of ability to pay. They also provide all these comprehensive services under one roof. So patients don't always have to go out into the community to get additional services when they need behavioral health, mental health, substance use services, even sometimes oral health related services in addition to their primary medical care. They are able to be treating the whole patient kind of under one umbrella and then work with community organizations to extend that reach to what patients need. Most unique, I think, about federally qualified health centers is that they're governed by a board, but they actually, that board has to be made up of over 51% have to be users of the health center and members of the community. So this is great because people who actually use the services can weigh in on how we should develop the health center and what needs that it needs to have. Across the country, federally qualified health centers are often the front door to primary health care. There are not a lot of providers in the community that are, in fact, there are probably none in most communities, offering that access to primary health care without asking a lot of questions. They just come, you take care of the patient. They take care of these uninsured patients who have nowhere else to go. A private doctor's office is not able to provide the sliding fee scale that they do and really isn't equipped to provide all of the rest of the services that patients need. Sometimes patients have insurance, but they may have really high deductibles, and so they're paying out of pocket for all of the services up until a certain threshold, which essentially means they may delay care, and if they weren't able to go somewhere like Amoskeag Health, they would go without care. And it causes a financial burden for those individuals that just need to get a simple, maybe go and get their blood pressure checked or go and see if someone for diabetes or a common cold. That can become very cost prohibitive for individuals with high deductible plans. FQHCs provide comprehensive and preventive care. So it's not just when you're sick, but really seeing patients and getting them on the path to being well and staying well. And that's so important because that reduces the need to go to emergency rooms and urgent cares and things like that for things that can be treated as primary care. It gives patients a better quality of life, and it actually reduces costs by avoiding those emergency room visits. As I mentioned earlier, the integrated care model is just something that allows a health center, a federally qualified health center, to take care of an entire person and not look at them as just their mental health condition or their behavioral health condition, but really think about what do they actually need. And often they can come into the health center presenting for one appointment and find out something else is going on and just have someone else come right in that same room with them and take care of the issue. And if anyone has tried to navigate the healthcare system on your own, I think that is such a blessing of the federally qualified health center model that patients who are very vulnerable have an opportunity to have that coordinated care. Nationally, there are 1,500 FQHCs nationwide. Nationally, FQHCs provide care to 1 in 7 Americans and serve as a healthcare home for over 6 million uninsured people and over 20.5 million people with low incomes. So just to give you a sense, you know the impact Amoskeag is making in the community, but they're part of this larger system of care that really is designed to help people who really need the care. In New Hampshire, Amoskeag is one of 10 federally qualified health centers with 60, across those 10 health centers, they have more than 60 practice locations across the state. In 2024, over 95,000 patients were served through community health centers in New Hampshire. Those were served by over 405,000 patient visits at these health centers. The visits represent things like well-child visits, adults managing chronic conditions, individuals receiving that behavioral health support, and families getting the care that they actually need. So they really would not have this care available to them in most of these communities across the state were it not for the federally qualified health center. Amoskeag Health is a great example of the FQHC mission in action. I too enjoy Chris. She doesn't call me every day like she does you, Betsy, but I do get to talk to Chris frequently, but to hear her speak this morning and collectively hear about all of the work that Amoskeag is doing is inspiring. They're providing comprehensive care to people every day, and it's that patient-centered care, care that patients would not receive if it were not for Amoskeag Health and their partners. When we're talking about a federally qualified health center, we're talking about more than just a health clinic. We're talking about a practice that is a community asset. This is an amazing gift to this community, and everywhere community health centers and federally qualified health centers are located is that same gift. It reduces barriers to care for people, and it strengthens the overall workforce by helping people get well and stay well, and keeping their health. And it's a practice that ensures essential primary care services are accessible to everyone. It's not enough just to have a building. It's theirs to say yes to people who are in need. FQHCs really are one of the best investments, and I kind of think sometimes the best kept secrets in a community, because sometimes people don't even realize they're walking in the door of a federally qualified health center. But they're providing this accessible, high quality, comprehensive primary care for today and helping reduce serious problems of tomorrow. FQHCs provide this tremendous value and impact on the communities they serve and their savings to the healthcare system, and most importantly to the patients that get the care at the health centers whose health outcomes improve because of the care. Thank you.
Thank you, Stephanie. We are going to continue on with Anna Thomas, who is our Director of Public Health at the City of Manchester. I've worked with Anna for a long time, and she is almost as inspiring as Chris is. So thanks for sharing the information you have for us today.
Good morning, and thank you so much for having me here. And I will never be able to rise to the level of Chris, but it's a nice goal. It's a nice goal to shoot for. So I can't say enough for our relationship over now decades. I mean, it's been an incredible journey, and I've only been with the city for 32 years, and I feel like I'm just getting started. I was with the mayor last night at our Mayor and Board of Aldermen meeting, so it's never a dull moment. And the challenges continue, but it is most important that the work does too. And nothing drives all of us more than the mission. And, you know, similarly to the mayor, I've worn a lot of hats. I'm also a veteran, cancer survivor, mom, wife. I like to have, you know, every so often a nice glass of red wine, you know, and to keep myself sane. And, you know, I've got great family and friends. I've watched my parents grow old and pass away. And, you know, I've had the life experience of generations. And I channeled Dr. Deitch because I also was blessed with meeting her and knowing her for the time that she was with us. So I keep her spirit with us at all times and everything we do. And I think she would be smiling today to know how far all of this work has come. And it is amazing to me. I have the vantage point as a public health director. I look at the entire city as my patient. And I have to sort of diagnose the patient all of the time and look for signs and symptoms. So I'm slicing and dicing the city all of the time by populations, by neighborhoods. And I also understand the weight of the work in the sense of how much it influences the rest of New Hampshire and the region. And I can't emphasize that enough. And I'm also a Game of Thrones fan, and I will say to people when I'm outside of the Manchester Circle and I'm at state tables, I will tell them winter is coming. And the reason why I say that is what happens in Manchester has implications and drives the health status of the rest of New Hampshire and even throughout our bordering states. We are the largest, people don't realize we're the largest community north of Boston. And that has a lot of power and influence. So trying to move a dot on the graph, which we are obsessed with, and Chris and I share the data minds of trying to measure what we do, to direct where we go strategically, the best use of those resources in those targeted areas. And we are constantly tracking performance measures. I will tell you that in our most recent, and I'm so happy you're using the healthcare landscape assessment, but we're also publishing data all of the time as far as we can go with it, down to a neighborhood level. We talk to residents all of the time and try to get their feedback and input about their experience with health in the community. And I'm just going to tell you that I also have the ability to look at 500 other cities across the country and compare ourselves to those benchmarks. And over again, I am seeing the impact of your collective work in those numbers. So we had targeted years ago, and Amoskeag Health ventured into this world way before we had a community schools model. You started to co-locate in schools, very smart, knowing that that's where families were going to be. It was a captive audience. We don't have school-based health centers. Now we're growing that. And at the time, there was a huge void between families in the city getting to care. But Amoskeag Health took that leap of faith and said, we need to get into the schools, we need to be present. And you started with really looking at the middle schools because we had high rates of adolescent pregnancy. We had some of the highest rates of adolescent pregnancy in the country in a state that had some of the lowest teen birth rates in the country. And we were having, for a size of the city, you all know it's about 115,000 population, about 185 babies were being born a year in the city to very young people. And you can double that number, by the way, the research will tell you, is that there's also induced fetal loss and induced abortions. So that number doubles, and that's your pregnancy number. So it is amazing to show that on a graph over time, the influence by you rolling up your sleeves and getting ahead of these numbers. We've dramatically reduced teen births, now almost lower than the state rate. And now we're seeing about 50 babies a year, still a lot, but nothing like we were dealing with before. I cannot say that that happened just by accident. That happened because you rolled up your sleeves, you were present, you were part of the solution, you were absolutely part of the plan. The other work that we're doing is looking at the neighborhoods, and to know the Stebbins Community Center is standing up, and I worship the leaders that made that happen, and so many of you have invested in that. We knew that there was need on the west side, and we knew that there's high need in certain neighborhoods on the east side. And that's how we look at the city. And in fact, there's 3 neighborhoods in Manchester, 2 on the east, 1 on the west, that have been persistently impoverished, meaning that the majority of people in those neighborhoods have been living below poverty for more than 30 years. And I'm going to tell you, because of the collective work and you getting into those neighborhoods and being present in those neighborhoods, we have reversed those trends. Those 3 neighborhoods are now decreasing their rates of poverty for the very first time. Now, which is amazing, but by no means are we near done. But we can't let our foot off, the gas. This is the time that we actually level up. This is the time that we push forward and we do more innovative work. Part of our partnership as a public health department is we work together and we have a couple nurses on our end. You guys have great staff on your end. And we'll do home visits for expectant mothers, high-risk expectant mothers. That's one of the greatest returns on investment that you can make in public health because it's lifelong. And we are blessed because we have an amazing referral system and we can get into these homes, which is really, really important to do, and to meet these families where they're at. The other hat that I wear is I'm also, on paper, the CEO of the other federally qualified health center, which is Healthcare for the Homeless. And a lot of folks don't realize that, we've had the good fortune of having Betsy and others on our board. And HRSA, for some reason, sort of discourages the cross-pollination between FQHCs. We vehemently oppose that because we work together. We're not competitors, we work collaboratively. And in fact, Healthcare for the Homeless, we see ourselves as a place where people can go to start their medical home, and then there's a warm handoff, right? If we can get them into the Amoskeag Health door and establish that relationship lifelong, we feel that's more of our success. So Healthcare for the Homeless should be obviously meeting people where they're at for that time and that moment in time. But in the school district, we've got about 12,000 kids. 600 to 800 in a year have been identified as experiencing homelessness. So it is amazing to me now that even the National Academy of Medicine, and I'm going to look at Dr. Paris because he is another human being I absolutely worship in this world, and it was one of the main reasons why I came today because I knew he was going to be here. This is another champion for pediatric health in the city of Manchester, but also total community health. And it is no surprise that now the National Academy of Medicine is measuring the health, vital signs of pediatric health with markers like whether or not kids are completing high school. And this is where the social determinants of health come into play, and this is where Amoskeag Health spends a lot of time. And if you look at those markers, there's 4. One is infant mortality, where we're blowing it out of the water. Together, we're really meeting moms where they're at in the early stages. School readiness, chronic absenteeism, and high school completion. My pediatrician would say, I measure my success by how many of my patients complete high school. And I think it's very clever to think that way because by doing that, we know that we are providing for families what they need to create healthy environments for their children to be able to function and thrive, which is the definition of health. So I cannot say enough about what Amoskeag has done for the city of Manchester, but more importantly, for the entire state of New Hampshire, because what happens here is going to drive these other rates. And the fact that your footprint now has been so well grounded and changing, and you're adapting and innovating to do telehealth, to get out of the clinic walls and get out into the community constantly, is the new way of working, and that's how we're going to change the health of the community for the better. I take it for granted that you're there, and I'm one of many people. For all of these years, I just know you're doing this work. I take it for granted, and I try not to imagine what would the city be like if we didn't have Amoskeag Health here. I just cannot imagine. So thank you for the years and years of service. I look forward to another 32 years of many, many years of working together. And just thank you all for the work that you do, because it is paying off in dividends, and you need to know what you're doing it matters. And like this morning matters. Thank you.
Thank you, Anna. And on to our third panelist. Dr. Stephen Paris is a retired physician and has been a leader in the healthcare space for many years. We are lucky to have him sharing his expertise with us as a member of our board. Thank you for coming.
It's always very hard to follow Anna. Unfortunately, she didn't bring her scratch tickets today, so I'll make it a little easier. For those who don't know me, I am a pediatrician by training. I essentially worked in two places in my 45-year career in medicine. One was in Massachusetts, in the Brockton area, which is a city very, very similar to Manchester, and then 25 years here. Brockton, at the time that I was there, did not have an FQHC. And it was the physicians in the community with the hospitals that got together to form and establish an FQHC there 35 years ago. And we had a fight against the community. The government in the community didn't want an FQHC because they were afraid of what it would bring to the community. They were worried it would bring patients coming out of Boston that otherwise wouldn't have been there, and not a very sensible thing, as well as the businesses. But we persevered, and it was the physicians in the community who recognized and actually staffed the FQHC for a couple of years before it could get on its feet and hire its own providers. In fact, legally, the FQHC only have to hire 2 people, have to have a CEO and a chief medical officer, and everybody else can come from wherever. And then I moved up here, and one of the first things that happened is I worked at Dartmouth, and someone at Dartmouth, Gina Balkus, took me around to meet different people in Manchester. One of the first people that she brought me to was Selma. She said to me before we got there, she said, "This is either going to be very short or very long." If it's very short and she doesn't like what you're saying, you'll be out of there in 5 minutes. 2.5 hours later, I was a board member at Child Health Services because Selma decided that I should do that, and she didn't really care that the rest of the board didn't even know me yet. But Selma certainly was one of my mentors. And what she taught me, and over again, and she talked about it all the time, is that the care that was provided at Child Health Services and now through Amoskeag is a level of care for the community that's absolutely necessary. One of the failures of medicine is that we've created a system for the providers. Most of the places where providers works for them, hospitals, medical groups, and we really need to create a system that works for the patients. And Selma would say the patients she takes care of have very specialized needs and need a specialized environment to do that. And she didn't say that it had to be reproduced everywhere. But part of a community whole is to have a place like Child Health Services or Amoskeag or Manchester Community Health at the time. I go back to the old days. But you need that to have a comprehensive way to take care of patients. And it works. But it only works if everybody works together. And I think that in this community, that's been the case, certainly in the time that I've been here. I know at Dartmouth that we certainly saw many specialty referrals from Amoskeag and Child Health Services over the years. At times we actually would even loan some providers that were necessary to provide care when there was recruiting issues. And that's very important. It has to be that give and take. In fact, when Chris first started, we used to refer our patient, if it was a new Medicaid patient, we used to refer them directly to Amoskeag if they didn't have an otherwise attachment to our group. And why would we do that? It's an economic reason and a clinical reason. Certainly the care that's provided is superb. But in our system, federally qualified health centers get paid very well, much better than the private practices for taking care of the same patients. And they get paid that way because they provide all those extra services. So it's an advantage to have those patients seen under the banner of a federally qualified health center. And we did that, and we were fairly successful doing that until the managed care organizations decided that they didn't like that idea and blew it up. But it was a problem. 12 years ago, we merged Child Health Services with the Manchester Community Health Center. And so why was that done? It was just two organizations, very similar mission, and it was really because we were adjusting to the circumstances that existed at the time. And by merging the two organizations, the first thing that happened is all the Medicaid patients that Child Health Services were seeing were now reimbursed at a very different level, and we infused over $1 million into the new entity. And that worked. That worked very, very well. But that was 12 years ago. And unfortunately, in today's world, things keep changing. And when the federal government does something, they don't understand at all the unintended consequences. The unintended consequences of the one big, beautiful bill, whatever, is going to be very, very difficult for federally qualified health centers. And everybody's concentrating on work requirements. Like that'll be a big issue. It'll be an issue. I don't believe it's actually going to be a very large issue. The bigger issue is the administrative burden that's now going to be placed on Amoskeag. Why is that an issue? Well, right now, a Medicaid patient is enrolled, and they're enrolled for a year, and then they have to re-enroll. That's a system. If a new patient comes into Amoskeag and doesn't have insurance, and the insurance folks there get them enrolled, they have 90 days to get that accomplished and can cover any services that were provided in those 90 days. Well, one of the things in this new bill, one is everybody's going to have to be re-enrolled every 6 months, so it's doubling the administrative burden on a population that doesn't do real well on administrative issues, and the 90 days of retroactivity is now going to be 30 days. So what's going to happen, unfortunately, and it's going to be like it was in the late 70s and early 80s when I was actually practicing medicine, where people are going to be on and off the rolls all the time. Amoskeag is going to see the patients. The patients will come through the door, they'll be seen, they'll be taken care of, and then it's going to be a crapshoot if we get reimbursed all the time. Eventually you might get reimbursed, and these are people that will be eligible. I'm not even talking about the people who are going to drop off the rolls. So we as a community, and I think that's, to me, the important part of this, really have to get together and think about what are the solutions and how are we going to save this entity from the disastrous changes the federal government is putting upon it. And it really is, and it has to be an all approach. Government, employers, patients, the community, because otherwise we're going to have some grave difficulties in the next few years. I haven't been retired, but the last couple of years I was running an FQHC in Massachusetts while they were recruiting a new CEO. A third of the FQHCs in Massachusetts are underwater right now. And Massachusetts is a great state for FQHCs to work. Massachusetts supports them. You can laugh about it in New Hampshire about Massachusetts, but if you're an FQHC, you like it because of a lot of things they've done. New Hampshire doesn't do that. New Hampshire is not particularly supportive, and it's going to be an issue. And I think we all have to work together. We have to educate the community on what the issues are, but work together to try to figure out how we're going to deal with the next set of issues like we did 12 years ago when we merged Child Health Services and Manchester Community Health, which was a fabulous deal, and it's done very well since. Thank you.
Thank you, Dr. Paris and Anna Thomas and Stephanie Pagliuca for sharing your insights as to the FQHC world. By you being here, we know that every morning matters to you, and every morning matters to us. And Christine Stoddard, who is with the Bi-State Primary Care and also has had family experience with us, is going to share how Amoskeag Health impacted her family. Thank you, Christine.
Thank God this is adjustable. So I love that there are themes being woven throughout what everyone is saying about FQHCs and how awesome Amoskeag is, because none of us got together before, at least I didn't talk to anyone other than the Amoskeag staff about what I was going to say, but you'll hear consistent themes in my speech. So I'm a lot of things also. I'm an attorney. I work with many of you in this room in that role. I work for Bi-State Primary Care Association as their Senior Director of Public Policy, so I'm one of the lobbyists that advocates for FQHCs at the State House and at the federal level. But I'm also a mom, and a wife of a family that was in crisis for almost 7 years. Next slide, please. So like every true love story, my husband Nate and I met in a dive bar in Concord, New Hampshire, and have been together for 16 years actually today, I believe. So, yeah, thank you. So Nate and I were married in 2013, and we have a lot in common. We mountain bike, health is important, eating well, taking care of ourselves. But nothing prepares you for what happens when you have kids. Next slide. So, pretty typical family, middle class. I had a good job, Nate had a good job, we took care of ourselves. I got pregnant shortly after we were married because we were old and needed to have kids sooner than later. So I had all of the access that I needed. I had commercial insurance. I was employed by a good employer who cares about our health. I had prenatal access. I went to every single appointment. I did all of the right things. I had a normal pregnancy despite being old and had gray hair. And then, like many women, I ended up having a C-section late in my pregnancy because Holden was just so happy he did not want to leave his space. So next slide, please. So this is Holden when he was about 6 months old. I didn't take this picture. My husband's cousin and from Manchester, is a professional photographer. So we did all of the right things with Holden. We took him to all of his pediatric checkups. He had some issues with nursing. We saw people who could help us with nursing. If you looked at him from just the outside perspective, never seeing him, he looked like just your typical neurotypical kid. But then we started to see signs of that something was wrong. And I should say, I'm not going to use the right words. I'm not going to use clinical terms because I'm just speaking to you as a mom who was seeing what I was seeing. So I'm gonna screw up. So when my husband was a stay-at-home dad, and we decided when it was time that Holden should go to preschool because he loved being around other kids. It was the highlight of his day, was being around other kids and not just my husband and NHPR in the background. So we put him in a private preschool in Concord, and he would get so excited to go. We couldn't get him to leave at the end of the day. He just absolutely loved being around other kids. Next slide. So eventually we got pregnant again, and we had our daughter Lydia. And Holden was in preschool at the same preschool, and these are the things that were said to me and my husband when we would pick him up at school. He was just too much. He doesn't listen to anything we say. He doesn't understand the word no. He won't stop when we tell him to stop. And we knew these things, right? We would see them at home when it was just us and Holden. But it wasn't as big of a deal because it was adults and one child, or one adult and one child. But when you're in a classroom with a lot of kids or with a new daughter in the house, it mattered because it wasn't safe. He did not always have a safe body. But when you looked at him and he would do something that wasn't safe, and then he would see your face just devastated after whatever happened, he was heartbroken. So he could not control his body at all. And yes, he was tiny, but when you're getting punched in the face on a daily basis before you go to work, it gets old. and it hurts. And I would worry every single day if I would go to work and someone would see the bruises on my face from a small child who was well loved and was sad every single time this happened. But now we had Lydia to worry about, right? She's also tiny, but she's very, very strong, thank goodness. But if you see in the middle picture, this is Holden. To me, I see him choking her. To Holden, he's hugging her. But hugging to Holden is hugging very, very firmly. And it's not always something another child would enjoy, right? Because he's hugging you as hard as he absolutely can. And it's because he loved his sister. He didn't mean to hurt her. He didn't mean to hurt me on a daily basis. He just could not control his body. And if you see in the picture on the left, this is like Holden to the T. He's always running to the next thing. He's always got to get to the next activity. His cousins in that picture are playing in the background. He just wanted to be with all of them because he loved them so much. Next slide. So we kept asking his pediatrician over and over and over. And this is nothing against our pediatrician. We love her. She's a great pediatrician. She just isn't an expert in neurodivergent kids. Now I know that term, but we did not know that at the time. And so she recommended eventually that we seek services at Community Bridges, who's the area agency when we lived in Concord. And Holden was diagnosed with a speech delay. And so that was one of the communication barriers that we saw. He would communicate with us through his head if he was frustrated. He would headbang, which obviously is not safe for a small kid. His speech therapist at the time recommended that we move to Bow. So we were living in downtown Concord. I love Concord. I love living in a city, being able to walk everywhere, but we had to move because it wasn't the best place for Holden. And I am fortunate, our family is fortunate in that we could afford to move. Not every family has that luxury, but by the grace of my husband's great carpenter hands, he flipped a house. So we could afford, he bought a house that was an absolute mess and cleaned the entire thing up from the basement all the way to the roof, and we flipped it. So we could afford to move into a house in Bow that had a backyard, that had space for him to run around in, but that's not everyone's situation, right? I realize that we are fortunate in that. So the reason why his speech therapist recommended that we move to Bow is because Bow had a really good preschool program. Also very fortunate, right? That doesn't exist in every town. Bow's preschool program included kids who were medically complex or had special needs, but they also included some what they called peers. So Holden was considered a peer, even though he had a speech delay. He didn't qualify for the preschool, but they could see too that something was going on and that he needed help and he needed to be somewhere else. The private preschool, so at one time he was actually going to the private preschool on some days and the elementary school preschool on other days. And we were asked by the private preschool to leave because Holden was too much for them to handle. These are trained teachers. And if you hear me choking up, it's because I am. It was infuriating, it was hurtful. Here's a kid who just wants to be loved and be around other kids, and he wasn't able to. So he started going to the Bow preschool full-time, but their version of full-time, right, in a public preschool is only a few hours, certain times of day. So those other days, he was back with my husband, who loved him, but he wasn't around other kids. Our pediatrician kept trying to help. She eventually referred us to a private psychologist. Wonderful woman, also not trained in neurodivergent kids. What she told us would work for maybe 5 days, and then it would stop working because it wasn't the right tool for our family. It wasn't the right tool for Holden. Next slide, please. So this is Holden and our cat, Salty. So through all of the visits that we went to with all of the experts that we were referred to, it was described as Holden's behaviors. Like this was a choice our kid was making. He was choosing to punch his mom. No, he was not making that choice. We knew that something was still going on beyond what the clinicians were telling us because he loved that cat dearly. Salty is a rag doll and very gentle, but Holden would just hug him so much. And even though Salty didn't have claws, I didn't do that. I got him that way, so don't judge me. He would make this screeching noise like, Holden, you're hugging me too hard, please stop. Holden wouldn't stop. Even though Salty was his favorite thing on the planet, he would not stop because there was something in his brain that wasn't communicating right. He was doing something with his hands, and the reaction from the cat did not tell his brain, please stop doing what you're doing because you're hurting me. Next slide. So we were obviously missing something. Our clinical team was missing something. The speech pathologist was missing something, right? In this picture, the top picture, you'll see that Lydia on her left eye has a black eye. Holden and Lydia were playing, and Holden would get so ramped up, he would throw things. And unfortunately, once in a while, they would hit Lydia in the face. And to see, right, it's heartbreaking to see that happen to Lydia. And as a woman of a girl, like, it just really hurts my soul, right? That this would happen to her in her home and by someone who loved her, who was a family member. But he didn't mean to hurt her. He just, again, could not control himself. And in the bottom picture, this is how every family interaction is. Holden is off the charts energetic. We're just trying to take a picture. He can't sit still. And sometimes it was fun and other times it wasn't. So we kept asking for help, everyone we knew. And he was in preschool during the pandemic. He was able to go to Bow Preschool for 2 years. The second year was during the pandemic. So he finished preschool and on a screen, which for some neurodivergent kids works, does not work for our son at all. It is very dysregulating. Next slide, please. So I ran into his OT from preschool during the kindergarten, I guess they call it like a visit. You go to the elementary school to learn what your kids are going to be doing during kindergarten and also meet the people who will be teaching your kids, and they also test your kids for special needs. And I cornered this poor woman in the hallway in tears, and I said, we need help. We don't know what's going on. We've been everywhere. This has been going on for 5 years. I don't know what to do. And she said, I know of 2 organizations that help people in this situation. Call one of them. One of them was Milestones Pediatric Therapy in Bedford, and the other was a clinic in Concord. I called both of them, and Milestones got us in sooner, so that's who we went with. We finally got some answers. Not only did Holden have a speech delay, but he also has sensory processing disorder. And if you see the stool, that's just a simple thing. It's a stool. That's all Holden needed to keep his hands to himself during dinner and to be able to finish his meal. Just a stool. Problem solved. So he saw this OT at Milestones, who's a lovely, lovely woman. Her name is Valerie. And after a while, Valerie said to me when I was picking him up one day that I think he's autistic. And I said, there is absolutely no way, Valerie. My sister's son is autistic. My sister was adopted, so he's not blood related to me. But I thought I knew what autism looked like. I had no idea. I work with the FQHCs, didn't know what they do, apparently. You'll hear in a minute. But it was just a shock. And I almost tried to argue with her because I'm an attorney and that's what I do. And she shut me down and she said, you need to have him tested. And I said, okay. And she gave me a long list of providers to go to. And again, this is during the pandemic, but things had started to settle down. People were accessing care again. Next slide. I called every large health system you could think of in the New England area. And on this list that Valerie gave me. And I saw that there was Amoskeag Health on the list. And I was like, what? They don't do this. I work with Chris on a regular basis. And I had no idea. But I called the larger health systems first because that's what parents do, right? They make mistakes sometimes. And one of them told me 18-month wait. Another one told me 24-month wait, just to get an intake, not to get services, just the intake conversation. Another health system told me 16 months and said, if I were you, I wouldn't bother signing up for an intake call. So I finally called Amoskeag, and at this point, I took the morning off and was making these phone calls, and at this point, I was really frustrated. And I called, and Lindsay LaFleur, I think I'm saying her name right, answered the phone. She did the intake while I was on the phone with her. So there's one positive thing happening already in that day. She told me that we would wait 6 to 8 weeks for an appointment. And so we had an appointment. It was 8 weeks out, I believe, and then they had a cancellation. So we were actually seen in 6 weeks, which was terrific. So I took Holden to Amoskeag. They asked me for so many documents that blew my mind, and to remember what we went through, I had to go back through them and look at how far we've come, and all of the material that the Amoskeag staff had access to be able to make an informed decision. And I took Holden to the appointment, and my husband stayed home with Lydia, and Dr. McGonigal and Dr. Hutton, both lovely women, went through this hours-long process with Holden. And by the very end, she took me into the other room and she said, Christine, Holden has autism. And I cried out of relief because first, he was almost 7 years old. And for that entire time, we struggled. And just to know what was going on was such a huge relief. So we do have commercial insurance, like I said, but this special medical program exists only at Amoskeag. They were able to get us in sooner. We didn't have to drive to Boston in 2 years, and we got answers right away in the appointment. Dr. McGonigal and Lindsay followed up with us and gave us a list of resources that we could use. And it was such a change in how we were treated. We weren't a family with problems. We weren't a family in crisis. We were just humans who needed help. And Amoskeag gave us that help. Next slide, please. So this is Holden today, and he actually helped me use Canva because I couldn't get it to work. So Holden went from not being able to use any device to helping his mom make a slide presentation. He helped me draw that arrow that's pointing to Holden. So Holden had a school performance last year, did not tell me or his dad that he had a speaking role, and we come to the event and there's Holden on the stage, and I was thinking, oh my gosh, what is going on? And he did an amazing job. This kid could not read. He could not write. He could not sit in a classroom. He could not be in a school gym. And here he is standing on a stage in an auditorium with hundreds of people staring at him. And he gave a speech because of Amoskeag, because of the help that we got at Amoskeag. Holden is now able to read. He does have dyslexia and dysgraphia, which means that dysgraphia means that you don't put spaces between words. It's all blended together, one long sentence. But to discover that, we had to go through another provider. So one of the things that comes with having an IEP, and we were able to get an IEP based on the information that Amoskeag gave us, is that you frequently have to update the neuropsych eval in order to continue to get services that meet the child's needs. So we had to pay for a neuropsych eval out of pocket, because guess what? Unfortunately, Holden aged out of Amoskeag's program because it's very limited due to funding, right? So we called around trying to find another neuropsych eval, and they either didn't take insurance, or, and this is in the last 6 months, they either don't take insurance, or if they do take insurance, you're going to wait 8 months again. I can't get his IEP updated in 8 months. It had to be done in this school year. And for a kid who needs supports in school, they have to be written down, or there's nothing that we can do about it if something happens. And something always happens, right? So we had to pay out of pocket $2,500 to get a neuropsych eval updated, just so that we could update his IEP to reflect what was going on, to reflect the fact that he has dyslexia, to reflect the fact that he has dysgraphia. Because without it, the school would not honor the tools that he needed. And it's not a criticism of them. They're not legally obligated to, right? So now Holden can be in a room full of kids. The picture on the right is him at his 10th birthday. This was a kid who struggled to make friends. We could not have birthday parties because they were too overwhelming for him. And we had a party at a painting studio, and kids came. And I have to say, like, that's one of the hardest moments, is when you're planning a birthday party, wondering if kids are going to come, because Holden worries so much about the past and what happened before we knew what was going on, before we had the right tools. And people came, and he had a great time, and it was just a wonderful day, and you can tell by the smile on his face. Next slide, please. So, like every family, neurodivergent or neurotypical, we have rough patches, right? But we try and think of the positive things and remember how far he has come in his journey and how good he is doing. In February, I took him to a house in Wolfboro with friends of ours who have 2 kids who are neurodivergent also. And we rented a very fancy house on a lake, and everything was perfect. And I walked in thinking, oh my God, what were we thinking? And it went so well. A kid who went from being dysregulated constantly to being able to spend a weekend in a small house with kids he doesn't really know. It went beautifully. It could not have gone better. And I left that weekend thinking, this is amazing. Like, these are things that I never thought were going to happen, and he did it. And since then, we've grown close with that family, and she actually works at DHHS, and she said that I, too, could share their story, because they, too, I didn't realize, were affected by Amoskeag. So Burton, the little guy in the middle, when he was 3, he was diagnosed with autism by Amoskeag. And his sister was not, who's also neurodivergent. And the differences between the tools that Burton received and the tools that Juliana, her oldest, received are very different, like stark, drastic difference. And it's just because Burton had interventions at an earlier age than Juliana did. They identified the tools at an earlier age, so they knew how to take care of Burton in a way that they didn't know for Juliana. We went hiking. We were in stressful situations with kids screaming. It went fine. We went to a camp with other children. It went so well. We got in the car to head home, and Holden said, "Mom, can we do this every February break?" And I just cried on the way home because it was just so touching. So I do remember, though, when Dr. McGonigal was asking me to describe Holden to her, I said, "Well, he likes Legos." And she said, "Is there anything else?" But it just goes to show, like, when you're in crisis, you don't remember all of the good things. You don't remember that he's a lovely little kid. You think about the things that you need to fix, right? And that's where my mind was at. And I'm no longer in that space, and neither is my husband or Holden. And right now, he's making these ginormous Lego villages, and he creates Minecraft scenes. I don't know if you're familiar with that game, but our living room is a giant Minecraft scene. And where does that come from? I have no idea. It's not me. But he's just amazing. Next slide. So right now we're doing things that we didn't think were possible. My husband's family goes camping on an island in Maine, in middle of nowhere, no electricity. You obviously can't leave if something happens because it's an island. And the first time that we took Holden there, I did not know if I would stay married. I did not know if we would survive as a family because it was so hard because we just didn't know, right? We didn't know how to care for him on an island and give him the tools that he needed to be successful on that camping trip. We now stay the full week with his family, and it's a wonderful experience. He plays with all of his cousins. He's doing very well. I have a Weimaraner, the picture on the right. I don't know if any of you have ever been around a Weimaraner, but they are very, very high energy. And I like them because I can take them running and hike with them, and they're my kind of dog. So I will always have them. Holden does not do well with Weimaraners because they are so high energy, he can't figure out how to manage his body around them. Versus a cat who's slow and moves purposefully. Lemon, that's her name, she just jumps all over the place. Holden is now able to be around a dog and not become dysregulated. Holden hikes with Lemon, Holden hugs Lemon, Holden lets Lemon sleep in his bed. And this might seem small to some of you, but this is a huge step for a kid who could not be in the room with a dog. So he's now aged out and tested out of occupational therapy. We learned through speech therapy at Milestones that Holden is a Gestalt language processor, which means he processes language in paragraph form, like bulk. We were able to receive in-home services for Holden, and he also participates in an intensive outpatient program in the summer through Direction Behavioral Health, which is where Valerie eventually went, his beloved OT. And so he is put in these social situations all summer long, and there's OTs there to help him navigate the social dynamics of being around other kids his age. It's super, super helpful. And now we also have an education plan, an IEP that meets Holden's needs. I received an email from a teacher that had read his IEP, but it said he's just out of control in PE class. And I said, well, yes, it's loud. He's going to be out of control if he doesn't have the tools that he's supposed to have in class, in that class, to function. And once he had those tools in place, it was okay. But none of that would have happened had we not gone to Amoskeag. We would still be struggling today if we did not go to Amoskeag. Next slide, please. So, also things that we never thought were possible. Holden is able to ride a bike now. For a kid who's autistic, and we did not know if he would ever be able to ride a bike. he's riding a bike. And also might seem trivial to you, but my husband and I are devout mountain bikers. And so this is an important part of our life that we now get to share with Holden because he's able to do it. And it was something that Valerie didn't think was possible when she first met him. He can paddleboard. He can even do it standing up. Also something that we didn't think was possible, and it's because of how your brain works, talking to the left and right sides of your body. And again, camping. And we're still married, it turns out, because of Amoskeag. I'll tell him that. Next slide, please. So this is, again, Burton and Juliana. The reason why Burton and Juliana are smiling is because Burton was diagnosed at a young age. They bought a trampoline at the recommendation of Amoskeag that they can use year-round. So Burton has a tool that allows him to get his sensory needs met outside all year round. He can bounce in the winter, he can bounce in his snow gear, he can bounce in the summertime. He has sensory needs. Amoskeag identified tools that he could use, and he's using them, and he's great. He's thriving. He's able to go to a camp for neurotypical kids this summer for the first time. He's 6. That's a huge, huge improvement in their lives, that they now have the tools necessary for Burton to thrive. Without Amoskeag, Burton and Holden wouldn't have had timely access to care. They would have had a much different patient experience. And I am confident that when the woman said, "If I were you, I wouldn't bother," that was the tone of that organization. That is not Amoskeag. Amoskeag wants to help you. They want to help you thrive. They want your kids to thrive. It's also affordable. I did use my commercial insurance when I saw Amoskeag, but I realize again, right, that I'm lucky. I am able to pay $2,500 for another neuropsych eval, but that is not typical in the state of New Hampshire. Many people in the Granite State do not have $500 in their savings account. And I forgot this statistic, I meant to look it up, but it's a huge amount. Of our friends and neighbors don't have $500 in the bank. Amoskeag will treat you and take care of your family if you don't have money in the bank. There is no place else that happens in the state of New Hampshire. The other thing that I wanted to add is that you get the best of the best when you go to Amoskeag. When I tell other clinicians in my work world that that Holden was diagnosed by Dr. McGonigal and Dr. Hutton, they're like, "Oh, you got the good girls." Like, they're great doctors. And there's not many of them in the state of New Hampshire. It turns out, I think there's 4 people who do what Dr. McGonigal does. Where would our state be without Amoskeag and without the services that Amoskeag offers people? I can tell you in no uncertain terms, I would still be drinking heavily. I have been sober for 3 years, but I was treating my anxiety after parenting and working all day with alcohol. Had we not gotten answers when we did, I would not be sober. I'm pretty sure we would not be married, because it's easier for a neurodivergent child to be around one person communicating to them, not multiple people communicating to them, because it's like screaming in their brains. So when Nate and I are talking about something in front of Holden, all he hears is screaming, and it doesn't work well. So in my head, I'm thinking, what's the best thing for Holden? What's the best thing for our family? Maybe separating is the best thing, because there would be one parent communicating with him versus 2. That's not us now, because we had the tools that Amoskeag offered us. Every kid deserves access to those tools. Every family deserves access to those tools. And we need to support organizations like Amoskeag so that every family has access to the tools, because I don't know what else to say. There's not enough good things to say about Amoskeag and the experience that we had. But I think that, thank you. I'm not lobbying for Amoskeag, but please support Amoskeag if you can, because this work truly, truly matters. Thank you.
Well, Kristen, you are very hard to follow, and I can't thank you enough for sharing that very powerful story. And we're so glad to hear how well everything is going for Holden and your family. Thank you again. Is this good enough? Make sure. So I think most of you in this room know Selma. Let me introduce myself first. Susan McKeown. I was blessed to be a nurse practitioner at Child Health Services from the beginning, and that was a lucky time for me. So I think most of you know Selma, and for those of you who don't, I hope by the time I finish my little chat here that you will feel like you knew her. And that's what makes it fun to share some of the stories for those of you who knew her. She was a very passionate, intelligent, sometimes short on patience, as we know, short on sleep always, and a woman who had more goals than most of us have in a lifetime. It was September 1972 when I met Selma, and Patrick and I had just finished up a year of volunteer work in Vista in Texas. And I wrote a letter that ended up on her desk because she was head of maternal and child health for the state. And I always remember how going in to see her, of course, she had written another grant, which she was great for, to make things happen. She wanted to put a team together for Greater Manchester Child Care Association and was hiring a doc, 2 nurses, an LPN, and a secretary. That's a big undertaking, but she was up for that. I was a bit intimidated that day as a 24-year-old walking in there, seeing her in her red and blue plaid suit, no makeup, no jewelry. We didn't have time for anything like this. We had many more important things to do. And she hired me to be community child care nurse. And what that entailed was getting into the 40 daycare homes in Manchester. And I call it infiltrating. That's my word, but that's really what it was. She recognized that these daycare homes had a large number of young children in them that had no eyes on them, and she wanted somebody to be able to spot that. And years later, I would say to her, you know, I think of that meeting that day and what I thought of you, and then I thought what you thought when I left that meeting. I just know she went, I got myself a good one, a young do-gooder that I can mold into anything I want. And she'd inevitably hit me with a pediatric jar. I did not do that. I said, yes, you did. Yes, you did. And if you don't like what you created, you can thank yourself. So, you know, most of us, I did that job, that aspect of it for a year, and then I got a call one day. And I always laugh to think of this phone call, because most of you know that when you call somebody, you know, you go, hi, Susan, you know, how are you? Am I catching you at a good time, or should I call back? You know, none of that. So I answer the phone, and it's, so, you want to be a nurse practitioner? And I said, hi, Selma. Sure, what is it? And there weren't any. There were no nurse practitioners in Manchester. There were 3 in the state. Well, it's an advanced practice nurse, and we need somebody with more skills, because we've got all these kids that their parents are being called from their low-income jobs to take them to the pediatrician for an ear infection or a fever, and if we had more skills, then that wouldn't happen. Now, do you know Dr. LaRiviere? He's a pediatrician in town. I said, no, I don't know him either. Well, he's going to be your mentor, and you're starting at Northeastern in September. And that's how I became a nurse practitioner. So there was a time where she needed a nurse practitioner another day, and I had 4 kids by that time, and I just just couldn't make that happen. And so she was, not happy about that, but she was, as always, very accepting of it. Until she got a flyer in her mail from St. Anselm College in the continuing education department that I was teaching a night course up there. Giving time somewhere else, and this was not. And I look at this brochure, and she has written over it in all red ink, what makes you think you can do this? What can you do that? Why do you think you're qualified to do it? It was, and I walked over to her. I see you got my note. I said, yeah, I got your note all right. I said, it was just very awful. And she said, I know. I shouldn't have done that. So I love the transparency. You didn't wonder where you stood with her, okay? And that was a wonderful thing. And I loved Fridays, how she used to sit herself by the cubbies, we call them, because now that's all electronic. We don't have cubbies anymore. Cubbies were great. That's where you got your mail and you stopped by before you left on Friday. And she would just place herself there to just touch base with everybody as they were leaving. So, how many lives did you save today? And it just gave you a chance to think a little bit about, well, is there anything I need to talk about? And it was a wonderful way to leave for the weekend. And I have to say, I think that's a wonderful quality of leadership in many ways that she showed. And then, because you feel like you could drop all your concerns on her, I came in one day with a flyer from Jordan Marsh in July with the back to school pictures of young children. And there was this little girl in this flyer. She looked to be about 6, starting first grade. And she had makeup on, she had gold hoop earrings, and it just didn't look right to me. And I said, do you think this is a good picture here? And she said, no, I don't. I'm going to call my friend at the American Academy of Pediatrics. And then the next thing I know, she does that. Then she gets together with her friend May Gruber, who was a good beneficiary. And that's where Media-Powered Youth came from. Making things happen. That's what was all so terrific. Another quite treasured memory, and I know we're over time here, but I have of her is I heard about the Children's Defense Fund putting on a rally in Washington, D.C., and I just thought it sounded like a really good thing to go to. It sounded grueling, too. They were leaving Concord at 8 o'clock on Friday night and coming back 8 o'clock Sunday morning. There was no rest. You just busted. But it still sounded good. So I went in and I told her, I said, I think I'm going to go to this rally. She rolled her eyes at me. The next day she comes into work. She said, I'm going with you. I go, okay. And what a journey it was. We had a great time. And for anyone that didn't know Selma, it would be easy to think that she was never married, had no children, because there was no time for anything like that if you were going to be omnipresent for everything that had to do with children. And they couldn't be more wrong. Selma was indeed married, had 5 children, many grandchildren. She was a wonderful cook, a wonderful baker, and it was one of just a lot of neat things about her. One day she was apple picking, as she was always out there berry picking and loved that stuff, a good baker. And we were talking about apples and applesauce, and I said, oh, Foley mill. I remember my mother used to have a Foley mill, and I don't know what happened to it after she died. I never got it. The next day I come into work and there's a brown paper bag under my desk and I open it up and there's a Foley mill. And she said, well, Morrow's hardware store was closing and I saw it and I thought of you. So, how can you not love? The last story I'll share is about apples. This lovely Jewish woman used to stop by my house on Christmas Day for my family gathering and drop off an apple pie. And I thought that was just so sweet. On December 2003, that was 2 months before she died, she came by the house and she said, I couldn't make you an apple pie today, but I did bring you a book. Yeah, that says it. So anyway, Selma envisioned the best health care for children and their families in our community, and the center named for her honor, the Selma Deitch Center for Children and Teens, is a reflection of the wonderful care, and you certainly have heard it today over and over again. And our clinic serves thousands of kids in the area. And with the changes in federal funding, it's a real stress right now. So in gratitude for Selma and what she meant to many of us in this room, I ask you to be as generous as you can today. And on your table are envelopes, pencils, pens. There's also a QR code for those of you who want to donate online securely. That's fine. So thank you very much for being here and supporting the work of Child Health Services, Amoskeag Health. Thanks.
I don't think we're supposed to cry at our own events, but that was really beautiful. I'm touched that you shared that. Thank you all. It's a blessing to have you in our lives. Go home and hug a kid somewhere today, because that was a beautiful set of stories and great feedback. We're really grateful for your time. Thank you.